we deal with the subspecialty called glaucoma, which is also called Kala Motia. So this is different from white motia or Safed motia, which is also called cataract. So how is glaucoma different? Cataract is something that if you wait for 10 years or more and then you remove it, you get the vision completely back. But glaucoma is such a disease that is completely free of any symptoms for the patient, which means that the patient will not have symptoms till the last stage. And by the time the patient realizes he or she has a disease, there would be a lot of irreversible permanent damage in the eye which cannot be recovered by medicines or by surgery. So glaucoma is different from cataract in being free of symptoms in the early stages and in causing permanent damage which cannot be reversed by any kind of intervention. So the question would be, फिर काला मोतिया treat करना क्यों है? Why should we treat glaucoma if it is irreversible? So when I said glaucoma damage is irreversible, इसका मतलब ये है कि जो डैमेज हो गया वो वापस नहीं आएगा, पर जितना बाकी है उसको बचाया जा सकता है. So the goal and idea of any treatment in glaucoma for any patient is to preserve and save whatever function is left over at that point of time till the end of his or her life. And let me tell you, it is a very well known fact that if the patient is very regular with drops, with the checkup with the consultant, and also regular in the kind of interactions with the doctor, glaucoma can never lead to blindness for any patient. So we have to remember, while glaucoma is called the silent thief of sight, which means that it causes blindness, irreversible blindness over long term, we can prevent that blindness if we detect it on time, and two, if we treat it adequately by consulting an appropriate doctor. So what are the routine surgeries that we do for glaucoma? Over the past many years, we had been doing something called trabeculectomy. This is like saying routine surgeries, let's say for other surgeries, a large cut which is involved, which takes a long time to heal, and which can take even several weeks or months to heal. Over the past few years, let's say 3 to 5 years, we have had a renaissance of other kinds of surgery which is called micro-invasive glaucoma surgeries. So these function like laparoscopic surgeries. For, like we know in surgery, there are two types of surgery: open surgery and a laparoscopic surgery. The laparoscopy advantage is that there is a small cut, but the surgery will be very quick and the healing time for the patient is very less. Recovery time is very less. So similarly for the glaucoma surgery also, this is something like a laparoscopic surgery for glaucoma. It's called minimally invasive glaucoma surgery. Now under this gamut of MIGS or MIGS, as it is very commonly called, we have a large number of surgeries. We have something called BANG, which is bent needle goniotomy. We have something called GAT, which is gonioscopy assisted transluminal trabeculotomy, and we have synechulisis and goniotomies. So there are other stents and implants that are there as part of the mix. Now why are we talking about this? Because at MTC campus we already have been doing something which is not done at all other places, which was glaucoma implants. So glaucoma drainage devices or implants called Ahmed glaucoma valve or ADI is something that we have been doing for many years for those kind of patients where the glaucoma could not be managed by routine surgeries and which had failed. So in those cases, implant surgery is the last resort. We had been offering the implant surgeries and doing this for many years, and this is not being done anywhere else in Odisha. Now, over the last 6 months, MTC campus has started the MIGS operation, which is the minimally invasive glaucoma surgeries, and we are now offering almost all the surgeries that are there under MIGS, which includes BANG, which includes GAT and synechulisis and goniotomies. So which means that these surgeries can be done as a standalone if the patient is not tolerating the medications that are given for glaucoma. This procedure is very useful so that he or she can keep the pressures, eye pressure controlled without the need for medicines and without opening the eye with giving a large cut. So glaucoma, how it affects the eyes is it causes damage to the optic nerve by either reducing by either increasing the intraocular pressure or the eye pressure, or it can cause a direct damage to the eye tissues, especially the filtering portions of the eye, which are called the trabecular meshwork. Either ways, what is damaged is the optic nerve, which acts as the camera to the brain. So what we see in the world as an image is actually seen in the brain, but the optic nerve serves as the camera which sends the image or the input to the brain. So if the optic nerve gets damaged, the image does not get registered in the brain, and because it is an irreversible damage, nothing much can be done for whatever part of the optic nerve has been damaged already. So glaucoma would affect all age groups. There is no particular age group that is affected by glaucoma. It can affect a one-day child, and it can affect a old age patient as old as 84 or 85 years. But the usual age of diagnosis that we say for primary glaucomas are 40 years. So it is recommended that if you have a family history of glaucoma, anybody in your family having glaucoma, it is good to have your checkup at least once in a year, at least more than 40 years of age. Glaucoma does not have any symptoms, which is why it is called the silent thief of sight. So glaucoma does not have a cure. Like I said, glaucoma can only be controlled just like any other multifactorial diseases like diabetes or blood pressure. This can be controlled and kept under check so that it does not cause further damage. So with this kind of an intervention, either with medicines or surgery or lasers, and surgeries can be, like I said, routine surgeries, or it can be MIGS, which is minimally invasive glaucoma surgeries. If you are able to adequately control the intraocular pressure, keep it under check, the visual function or the part of the optic nerve that is not damaged can be saved and protected till the end of the patient's life. Glaucoma is a completely different disease as opposed to cancer. Cancer, like we all understand, involves multiplication of cells abnormally in any particular tissue, which should not happen beyond a certain point. Glaucoma is something that happens in a tissue that is normal to the eye, but it is what we know is that we all age, become old. What happens in glaucoma is the aging is accelerated, which means that the changes that we would see in ourselves at maybe 500 years, if we live up to that age, will be seen when even we are 30 years or 40 years. That is glaucoma. So we all undergo a process of aging, but if that aging process happens many years before it should have been happening, then we see something called glaucoma. Replacement of eyes is not an option for restoring vision anyway. It is not that the whole eye is anyway restored. It in a whole is restored. What happens in a eye transplant is actually parts of the eye. The most common part of the eye that is transplanted is the cornea. So if someone's cornea is damaged, that is replaced with a healthy cornea from a dead person, which has been donated by a dead person, and that cornea can function in that other patient and give them clear vision. For glaucoma, this cannot happen because what is involved is deep within the eye in the form of an optic nerve that connects the eye and the brain. So there are a lot of connections between the eye and the brain. So it cannot be a simple procedure that we replace the eye but we cannot replace the connections that happen between the eye and the brain from childhood to adulthood. That those cannot be replaced as of now with the technology that we have. There are study groups who are studying there in animal models, but even in animal models, stem cells or any kind of implant eye replacement has never been successful in restoring vision in glaucoma. ग्लोकोमाटा किसी भी सिम्पटम्स हेनी जेबे पेशेंट को जानव कि किसी आखिरे प्रॉब्लम अच्छी से समय पर्यंत ऑलरेडी 90 to 95% would have got damaged. So we do not want the patient to lose 95% of the optic nerve function. So always advisable patient जदि आपनकर फैमिली हिस्ट्री अच्छी आपण फैमिली रे किसी ग्लोकोमा पेशेंट अच्छी आपनकर रिस्कटा 2-3 टाइम्स अधिक रोची आपनकर बहुत बड़ा चश्मा अच्छी डायबिटीज अच्छी ब्लड प्रेशर अच्छी ये रिस्क फैक्टर्स जदि रहिले एटलिस्ट 40 इयर्स पर्यंत गोटे थर एटलिस्ट डॉक्टर को जाइए डिटेल चेकअप करिवो. नॉट दैट यू गो टू एन ऑप्टिकल्स एंड गेट योर आई पावर चेक. डिटेल चेकअप विथ एन ऑप्थेल्मोलॉजिस्ट इज व्हाट विल टेल यू वेदर यू हैव ग्लोकोमा. किसी भी सिम्पटम्स हेनी. सो सेफ्टी प्रोसीजर जमती आप नॉर्मल रूटीन बॉडी चेकअप करुच्ची होल बॉडी मल्टीपल टेस्ट करुच्ची बियॉन्ड 60 एबे सब पैकेजटा अच्छी हॉस्पिटल रे सेमिति ही आखिटा चेकअप मु रेकमेंड करुच्ची बियॉन्ड 40 इयर्स 35 इयर्स एटलिस्ट गोटे थर जाइए डिटेल चेकअप करिवो. नॉट जस्ट विजन दृष्टिटा काला मोतिया रे लास्ट रे जीवो. सो एटलिस्ट डिटेल चेकअप जदि करिले जदि आपनकर ग्लोकोमा थिबो से टेस्ट रे डिटेक्ट हबो एंड कौन दरकार हम से अर्ली स्टेज रे अच्छी कौन स्टेज रे अच्छी से कंट्रोल करने मेडिसिनटा दरकार कि लेजर दरकार से डॉक्टर कही पारे देखिकी. बट सिम्पटम्सटा ग्लोकोमा रे किछि भी हबो नाही. सो एवरी प्रसाद रे चार्जेस रे मल्टीपल टेस्ट पाई मल्टीपल चार्जेस तो अच्छी बट वी डू नॉट चार्ज एनी ऑफ द कम्युनिटी पेशेंट्स. Almost 50% of the patients that we see here with glaucoma or any other eye disease are done free of cost. So cost should not be the factor deciding whether you go for a checkup or not. So in LV Prasad, all the patients are treated. If you see the motto, our mission is sight for all so that all may see. So whether the patient is from an economically poor background, BPL, or even not even a BPL. We have so many patients who are farmers. They don't have the BPL card. So we see them free of cost, and many of them, if they are checked in the paying, we doctors turn them into non-paying and we give the surgery free of cost. So glaucoma does not have a specific reason, just like it is very difficult to answer why does somebody get diabetes or blood pressure. So partly the genetics play a role, partly the environment, the diet, the lifestyle plays a role, but these diseases are called chronic multifactorial degenerative diseases. Directly affect hoboni. As doctors we cannot say that seta effect kichhi bhi hoboni, but directly affect hoboni. For example, computer, mobile ebe sabu mandatory हे गला. आपनकर जॉब रे सबुटा दरकार एबे कंप्यूटर रे लैपटॉप रे मोबाइल यूज करबा स्टूडेंट्स कर क्लासेस मोबाइल रे हे गला. So आम अवॉइड करि परिबेनी. But if you maintain a routine and a discipline while using this and use those appliances and not abuse them or misuse them. कहीं मो कहूँ एबे आपण मोबाइल यूज करुच्छी और लैपटॉप यूज करुच्छी. मोबाइल आपण जदि क्लासेसटा यूज करिकी तापरे 3 hours 4 hours जदि आपण ऑनलाइन व्हाट्सएप यूट्यूब देखुची सेटा अननेसेसरी. एटलीस्ट दैट अननेसेसरी टाइम यू कैन रिलैक्स. सिमिलरली लैपटॉप जदि आपनकर दरकार यूज करियो पई 6 घंटा 8 घंटा 12 घंटा एटलीस्ट वी वुड से एवरी 2 hours गेट अप पानी छाटी देबे वॉश योर आईज एंड गिव अ रिलैक्सेशन ब्लिंक फ्रीक्वेंटली. These are the things that we tell, minor modifications that you can do while using the mobile or laptop. But directly it does not cause glaucoma, it does not cause any eye disease. But discipline is always mandatory when using these instruments or appliances.